When you bring your kitten or your cat to your doctor for their first vaccination, one of the first things they're going to recommend doing is testing your cat for both AIDS and leukemia. These are two viruses that can be transmitted from the parent, from the mother, to the offspring. So it's not something that a kitten needs to go out into the wide world to get, although that, of course, is possible. The leukemia virus is exactly what it sounds like. This is a virus that can cause leukemia, can cause cancer, a blood cancer, in cats. Please be aware this is a cat-specific virus. Dogs cannot get this, and people cannot get this. The virus is transmitted in pretty much everything that comes out of the cat. Blood, urine, feces, saliva, cough, hack, wheeze, sneeze, sharing litter pans, sharing water bowls. So if the cat is outside, of course, a little bit more risk. If the cat is inside, there's really no risk as long as they're negative to begin with. And of course, can they get this from their mother? If the cat is positive when they're tested and they're young, it doesn't always mean that they're going to succumb to this disease, leukemia. You want to retest them about 30 days later. If they're negative, wonderful. If they're positive, we have a problem. Okay, so let's say we test our cat is negative. If our cat's going to go outside, we should start leukemia vaccines, 1 dose, 4 weeks later, a second dose, a booster a year later. Now here's where it gets a little interesting. The recommendations are to give cats boosters yearly. The problem with that recommendation is it's very, very, very difficult to give an adult cat leukemia. If they haven't got it, if they haven't developed the disease when they were young and haven't tested positive when they were young, once they're older, the odds are they never will. So it's kind of, do we really need to vaccinate them every year for a disease that's incredibly hard for them to get? Even the professors at Tufts University, our local veterinary college in Massachusetts, kind of have a bit of an argument with that. My recommendation is start when they're young, vaccinate them when they're young, a booster a year later, and then I would do it every 3 years if they're going to continue to go outside. If they're indoors and they don't go outside and they're not coming in contact with other cats that go outside, I don't recommend vaccinating them for leukemia at that point at all. The leukemia virus requires pretty close contact to spread. It's not a hardy virus. It does not last long outside of the body. It's incredibly easy to kill with almost every disinfectant, Lysol, bleach works on just about all of these viruses that we've been talking about. So this is a vaccine that I really only recommend for outdoor cats who are at risk. As far as AIDS goes, believe it or not, there is an AIDS vaccine. It is remarkably ineffective for way over 95% of the cats in the United States. Apparently, when this vaccine was developed, they tested it against a strain that is not very common in the real world. It seems to be common, at least at that time, only in the extreme northwest of the United States. So vaccinating cats out of that area with this vaccine, well, essentially you may as well be giving them sterile water because it won't work on them. So there really, for all intents and purposes, is no effective vaccine against the feline AIDS virus. Disease-wise, that is something you should discuss with your veterinarian. Again, it's a virus transmitted for cats only. Humans do not get this. The standard vaccines then. Distemper in cats, very, very different from distemper in dogs. Distemper in cats is also called panleukopenia. Pan means all, leuko is your white blood cells. Penia means I don't have any. So panleukopenia, it's exactly what this does, is it wipes out your white blood cells. This virus likes to attack these rapidly reproducing cells of the intestinal tract, so it causes extremely severe vomiting and diarrhea, very, very, very similar to the dog parvovirus that we spoke about earlier. In fact, the distemper virus in cats and the parvovirus in dogs share about 98% of the same genes. So very similar viruses. Fatality rate, extremely high. Very, very, very high. Again, vomiting, diarrhea, there is no specific treatment, so it's all supportive care. The vaccines for cats, initially we used to do them starting again 6 weeks, 4 weeks later, 4 weeks after that. We used to do them if the cats came in at an early age, 8 weeks old, we would do 8 and 12 weeks. The recommendation now is to think about doing 3 of them as well, 8, 12, 16 weeks. A booster a year later, and this is a vaccine that should be repeated every 3 years. As long as we've got a competent immune system, this is great. If the immune system starts to fall apart, can you theoretically get this disease when you're older? I suppose it's theoretically possible, but I don't know that anybody's done any research on that. The other two major players in cats for vaccines are rhinotracheitis, also called the herpes virus, and calicivirus. The herpes virus, coughing, hacking, wheezing, sneezing. The calicivirus, coughing, hacking, wheezing, sneezing. How do you tell them apart? Very often from a distance, you can't. The herpes virus is known for causing a lot more ulcers in the eyes, corneal ulcers. The calicivirus tends to cause a lot more ulcers on the tongue, so the animal has a lot of trouble eating. They really have these erosions on their tongue. Very uncomfortable. But that's in severe cases. If you have one of these mild, moderate cases, sometimes you can't tell the difference. Prevention, very hard. It's a virus. Best prevention, vaccination. Just like everything else, we start them when they're 8 weeks old, repeat it 12 weeks, usually we're okay. Concern, should we do a third vaccine? Not wrong. 8, 12, 16 weeks. Booster then a year later. After that, once every 3 years. Those are really the main vaccines that are used. There are some others. It's debatable if these should be used or not, if they're even effective. There is a vaccine for dermatophytes. The common term for dermatophytes, ringworm. And ringworm is a pretty common problem in cats. There's a little bit of debate on how effective this vaccine really is. Do I recommend it? No, I do not. Do I use it? No, I do not. Is it wrong to use it? I can't say that. There's a vaccine out for feline infectious peritonitis, FIP. This is a devastating disease. Unfortunately, the vaccine has been shown that it can sometimes cause FIP. So this is not something we recommend doing at all. Rabies in cats, just like rabies in dogs, start when they're 3 months old or older, 1 dose, repeat a year later. After that, it depends on where in the country you live. Again, in Massachusetts, if you live in Massachusetts and you do the vaccine timing properly, the vaccine can be good for up to 3 years. It also depends on which type of vaccine you use. The one that we recommend is actually only licensed for 1 year, so we do recommend doing a booster every year. Very quickly on cats, let's talk a little bit about vaccine sarcomas, reactions to vaccines. Okay, vaccine sarcomas. These are cancers that are actually caused by the vaccine. Now, this is a very, very, very rare occurrence. It's estimated that it is approximately 1 in 10,000 or even less frequent than that. So this is not a common issue. The sarcoma that's caused is very, very severe. These are almost impossible to surgically remove. So the recommendation that has now become standard is we give our vaccines on the limbs. And I know this is going to sound absolutely horrific, but the idea is that if we have a vaccine reaction that causes a sarcoma, a cancer, on the end of a limb, if we absolutely have to, we can amputate a limb. If we have to give the vaccine between the shoulders, as was the practice 30 and 40 years ago, you can't amputate an area between the shoulders. It's going to spread. So that's the rationale behind the vaccines now being given lower down on the limbs. Some places will even give the vaccines in the tail of a cat. And this is fine as long as the cat can tolerate it. It's a practice I've found is often more uncomfortable to the cat than the benefit that one gets, because we are talking about an issue that's incredibly, incredibly rare. One of the reasons that we use the one-year rabies vaccine is that it is less likely to cause one of these vaccine sarcomas. Please be aware, this is a cat-only issue. It is not an issue that affects dogs. Have you decided to come back? We were talking about cats and you said, no, I'm not going to listen to that. Nice to see you. Those are the basics for vaccines on dogs and cats. If you have any issues or questions, please call the Lakeville Animal Hospital, 508-947-1309. We'll be more than happy to help in any way that we can. See you next time.